Today we're jumping into one of the most fascinating challenges in all of medicine. This is way more than just a common cold. It's a true medical detective story, a race against the clock to solve a mystery happening deep inside the human body. I mean, just think about that for a second. A fever is your body's alarm system, right? It's screaming that something is wrong. But what happens when that alarm just keeps blaring week after week and every single test comes back totally normal? It's an incredibly frustrating and honestly pretty scary place to be.
And, this isn't just some hypothetical scenario. It has a real name in the medical world. For decades, doctors have been wrestling with this exact problem, a phenomenon they call a fever of unknown origin. Now, before a doctor can officially label a case with this term, it has to meet some very specific criteria. This isn't just any fever that hangs around for a few extra days. The medical community has a really clear set of rules for what qualifies.
So here's the official definition. A fever of unknown origin, or FUO for short, is a prolonged fever where the cause just can't be found, even after a really thorough, appropriate workup. It's basically the medical equivalent of running full speed into a brick wall.
A case only gets the FUO title if it checks all four of these boxes. First, the fever has to be significant. We're talking at least 101 degrees Fahrenheit. Second, it has to drag on for at least 3 weeks. Third, the patient can't have a known reason to have a wacky immune system, like being on chemotherapy. And finally, the big one. The diagnosis is still a total mystery, even after all the standard initial tests are done. Okay, so once a case is officially an FUO, the real detective work kicks in. Clinicians start by looking at 4 main categories of what could be causing it. You can think of these as the 4 major suspects in our medical whodunit. And as you can see here, pretty much all FUO cases get sorted into these 4 buckets. Infections, something called non-infectious inflammatory diseases, or NIIDs, malignancies, and then this last catch-all group, miscellaneous. Doctors have to systematically go through each one.
So, suspect number 1 is infection. And globally, it's the most common culprit. But we're not talking about a simple case of the flu here. These are usually sneaky, hidden infections, like an abscess buried deep in the abdomen, an infection growing on a heart valve, or even tuberculosis that's not in the lungs where you'd expect it.
Suspect number 2 is when the body's own immune system just goes haywire, sparking all this inflammation. And what's really interesting is that this category, NIIDs, is actually the most common cause of FUO in Western countries. This includes things like autoimmune diseases, such as lupus, or conditions like Still's disease.
Our third suspect is one of the most serious, malignancy, which is just another word for cancer. For some kinds of cancer, especially lymphomas and leukemias, a persistent fever that you just can't explain can be one of the very first signs, sometimes showing up way before any other symptoms.
And finally, we've got the miscellaneous category, the ultimate what else could it be bucket. The cause here could be anything from a reaction to a new medication, what they call a drug fever, to something way more complex, like a hidden blood clot. It just goes to show how wide a net the investigators have to cast.
So with all these possibilities on the table, how do doctors actually sort through this maze and crack the case? Well, it's not about random guessing, it's a super methodical process of elimination, following every little clue one step at a time.
The whole investigation follows this clear 6-step pathway. First, doctors confirm the fever is real. Then, they go back and meticulously review the patient's entire history. After a really thorough physical exam and some basic tests, they'll move on to advanced imaging, like a CT or a PET scan. And only then, once they have some clues, do they move on to highly specific, targeted tests.
And that detailed history in step 2, it is absolutely critical. This table shows you exactly why. Just knowing where a patient is from or where they've traveled can be a massive clue. In Western Europe, the prime suspect is often an inflammatory disease. But in Asia and the Middle East, infections like tuberculosis are way more common. That one piece of info can totally change the direction of the investigation.
Okay, so here's where things get a little weird and counterintuitive. You'd think that with all our amazing modern tech, CT scans, MRIs, PET scans, we'd be solving more of these cases, right? But actually, we're seeing something called the FUO paradox. Let's break down what that actually means. So back in the day, a whole bunch of different illnesses could end up being called an FUO just because the diagnostic tools weren't that great. But today, our advanced imaging is so good, it solves the easier cases almost right away. So the ones that are left, The cases that actually meet those strict FUO criteria today are, by their very definition, the most complex, the most puzzling, and the absolute hardest to solve.
So after this whole long, intensive investigation, what's the final verdict? What actually happens to the patients who are at the center of these incredible mysteries?
Well, throughout this entire process, doctors are on super high alert for any red flags. I'm talking about things like a patient's condition suddenly becoming unstable or their symptoms getting worse really fast. Those are signals of a possible emergency that needs to be found and treated immediately, like a serious heart infection or a really aggressive cancer.
But what about the cases that never get solved? Well, here's another surprise. The outlook isn't always bad. A lot of patients whose fevers are never actually explained end up just getting better on their own. The real outcome depends entirely on that hidden cause, with cancer having the worst prognosis. And it turns out people with those ongoing inflammatory issues are the ones most likely to remain a medical mystery. And that leaves us with this one last, really fascinating question. In this age of incredible medical technology, what does it really mean when the body's oldest, most basic alarm signal, a simple fever, can still leave us completely stumped? It's just a powerful reminder of how incredibly complex we are and of the mysteries that still lie at the very heart of medicine.